many physicians have been ordering MammaPrint and Blueprint on core biopsy samples rather than waiting to obtain the resection sample. The core biopsy that was used to make the diagnosis of breast cancer can certainly be used to obtain the MammaPrint and Blueprint results. The benefit of having this information early on is significant for both patient and physician. Imagine knowing that a tumor is MammaPrint high risk and genomically basal by Blueprint prior to the surgical consult and prior to tumor board, so that the decision as to how to treat that patient may then be directed to neoadjuvant therapy as opposed to going directly to surgery. In other cases, a tumor may be large and estrogen receptor positive and may be considered for neoadjuvant chemotherapy, but with a preoperative MammaPrint could be low risk and Blueprint could be luminal, in other words, a luminal A tumor, which would strongly argue against neoadjuvant chemotherapy and would suggest instead that the patient would be better off going directly to surgery. The reason that this is possible is that the turnaround time for obtaining a MammaPrint and Blueprint analysis on a core biopsy is no more than 3 to 5 days from the time the sample reaches our laboratory. This rapid turnaround time allows physicians in the circle of care to have this vital genomic information at the time of the tumor board discussion about the patient's care, and in many cases prior to the first surgical consult. So at the time of that consult, the surgeon can definitively discuss the most appropriate plan of care for that patient. Having that information in hand prior to surgery and prior to the initial consultations gives the patient tremendous comfort in knowing that her treatment plan is definitive and will proceed according to the information provided by